Hello, my name is Dr. David Morris with Magnolia Medical Center. I'm glad you're taking time to watch this video. I know it will answer a lot of questions for those who suffer with digestive disorders and metabolic issues. I want you to know that I created this video some time ago. And like this short intro here, there are some other edits at the end of the video that are very important. I've changed. I look a bit younger in the main body of this presentation than I do in this intro. But the science and our approach to treating digestive disorders has not changed. Something that we are very proud of is that our approach to handling complex metabolic issues like digestive disorders has been so successful that we had to expand our facilities and our team in order to help patients. So while it is me doing this presentation, our team and our team approach is the reason for our success in helping people get their lives back. As I mentioned again in the video shortly, please watch this video all the way to the end. I know it is a little long, but all of the information is important to you solving these issues.
Hi folks, I'm Dr. David Morris. Today we're going to talk about chronic digestive problems. There's a lot of information that we're going to be going over today. So my advice is to sit down, relax, take notes if you want, but I'm going to be talking about many different things today. In my practice, we specialize in functional medicine and functional neurology. We manage and support chronic problems in our clinic. That's what we do all day long. So we're going to be talking about the difference between acute problems and chronic problems. Let me tell you, all of my patients who have chronic problems, chronic fatigue, brain problems, depression, you name it, they all have problems in their gut. So we're going to be talking about functional medicine and treatment to really get into the underlying causes of chronic digestive problems. Even the father of medicine, Hippocrates, said, look to the gut. There you will find the cause of almost all human illnesses. The bottom line is, if your gut is not working, you're not going to be healthy. So a lot of this information, don't expect to hear it from your medical doctor because this is really a different approach. And I know you're going to see that there are solutions if you watch this entire video. Folks, just a disclaimer or disclosure here. I'm not trying to treat you by this video here. Please make sure that whatever changes you make, they're made in with the help of a competent physician. Folks, as I mentioned, in our clinic, we specialize in handling chronic problems. We're a medical clinic. We have a medical director. We have 2 nurse practitioners. We have a certified holistic health coach as well as myself, another chiropractor that works here. We specialize in handling chronic problems, and we use the functional medicine and functional neurology. We all have tremendous amounts of postdoctoral education in these fields, and our goal is for you to be a success. We want you to be as healthy as possible. So, if you suffer from any of the following, pain in the abdomen or your stomach, bloating, so many of my patients come in and they're bloated. They have heartburn and acid reflux. They're on Nexium or Prilosec or Tums, you name it. They have excessive gas, belching, burping. They have constipation or diarrhea or both. Their bowels not emptying completely. They have a coated or a fuzzy tongue. They have bad breath. They're constantly using antacids. They have undigested food in their stool, fatigue or body aches. When your gut is not working right, your gut is going to be inflamed. When your gut is inflamed, your whole body and your brain's immune system gets activated. You'll have nausea, vomiting, depression, anxiety, brain fog, chronic sinus issues. Folks, your sinus membranes that come from the same tissue embryologically as your gut. We see so many people that have been given tons of antibiotics and things for chronic sinusitis, and the problem is not even in their sinuses. If your gut is inflamed, a lot of times your sinuses get inflamed, and that's because of the connection embryologically. All right. Have you been diagnosed with any of the following? Irritable bowel syndrome. Now, folks, this is a bit of a joke of a diagnosis, I'm sorry to say. It means your bowels are irritated. It's a wastebasket diagnosis that honestly means nothing. What you really want to know is, why are your bowels irritated? Ulcerative colitis, Crohn's disease. These two together make up what are called chronic inflammatory bowel diseases. And you can add into that category celiac disease. So gallbladder problems or gallbladder removal. So many people have had their gallbladder removed, but there's a reason why your gallbladder develops stones or sludge. And we're going to talk about that today. GERD, or gastroesophageal reflux disease, Barrett's esophagitis, colitis, gut infections, polyps, pancreatitis, ulcers. Have you been diagnosed with any of these? What I see is people come to me and they're like, I've got this diagnosis and I'm on these medications and I'm still suffering. Well, it is because these medications don't address the underlying cause. Look, our healthcare system in this country is very, very good at acute problems. If you have a heart attack or get involved in a car accident, heaven forbid, or you have a life-threatening infection, our healthcare system is awesome at that. It's the best in the world. Our healthcare system is really, really lousy at chronic problems, which is what you have when you have a digestive issue. It's a chronic problem. The reason why is because our healthcare system is pharmaceutically driven. If you don't believe me, all you need to do is turn on the TV set and you'll see some commercial for medication that you can't get unless you go to your doctor. Folks, the pharmaceutical companies are driving our system, and that's just a fact. Don't shoot the messenger. And it's the way it has been since the 1950s. So they're not so much interested in getting rid of or addressing underlying causes. But that's what we do in functional medicine and functional neurology. Through specific lab testing, we can identify the underlying causes to your chronic digestive problems, and then we go about fixing them. And that's really what the big picture of what we're going to talk about today. What I'm going to go over with you today is information. I'm going to go over with information that is in standard medical texts regarding function and physiology. The things I'm going over today, they're not my opinion. You can look up any of this information for yourself and study it. It is just not a popular approach because it does not sell a lot of medication and drugs. It doesn't promote major surgeries. So our healthcare system is great at acute conditions and really lousy at chronic conditions. And I want to prove it to you, okay? As if you needed proof. But I want you to ask yourself right now, what are 2 things you can do right now in your life that would make you healthier? Think of 2 things you can change in your life that would make you healthier. But shouldn't take you too long to get it. Got it? It's all right. Now I bet none of you that are watching this are thinking, I need to take more medication. Folks, you can't medicate yourself out of a chronic condition. You have to get to the underlying physiology. But that is not how our medical system is set up. So if you're frustrated and you've got all these symptoms that we've been talking about, then you need to watch this video all the way through in its entirety. Okay? Now, have you had several diagnostic tests run? All right, maybe you've had diagnostics done and you still suffer. Maybe you haven't been given a definitive diagnosis. All right, I've had people go to the Mayo Clinic, patients of mine, in all kinds of different respectable hospitals, and they've done all of these tests and scopes and everything, and at the end of the day, they're given a prescription, and they don't talk about the things we're going to talk about today. Like I mentioned, the cause. Okay, some key concepts to remember here, all right? Functional medicine is very, very different versus traditional medicine, as we've already explained. In functional medicine, which is what we do here, my nurse practitioners, medical director, myself, we identify the underlying causes and we go about correcting them. Whereas traditional medicine is going to give you a medication for the symptoms. Here's another key concept. Your brain controls your gut, and your gut heavily impacts your brain. This and this are intimately connected. They've done studies on football players who get concussions, and within hours, the lining in their gut is breaking down. Now, I'm not going to go into the whole physiology, but this and this are very tight. They're connected. Up to 80% of your immune system, your white blood cells, reside in your gut. Your white blood cells, your immune system, protect us against what doesn't belong in our body. Well, how do things get into our body? Well, about 80% of it is through our mouth. So 80% of our immune system lies in our gut. And when I say gut, I'm talking about one long tube from your mouth, your esophagus, your stomach, your small intestines, large intestine, colon, and anus. Lining that whole tube is 80% of your immune system. The integrity of the barrier between your gut and the rest of your body is absolutely crucial to your health. It's like a screen door on the back of your home and on a hot summer day. And if that screen door has holes in it, then things are going to get into your home that don't belong in your home. If your gut integrity is not good, it's like having cuts all over your skin. you're going to get infections eventually. So we see things enter the body when the gut integrity isn't good. And that sets off a whole cascade of problems that you're probably suffering with. That's called leaky gut syndrome, which we're going to get into more. Folks, you'll never be healthy if your gut is not healthy. Now, the first thing I'm going to really emphasize in my discussion today is the brain-gut connection. One of the earliest signs of a poor functioning brain is poor digestive function. Folks, we just think that's normal. We think it's normal to pass gas all the time. We think it's normal to burp and belch and be bloated after we eat, or to have acid reflux. We think all of that is normal, or to have a bowel movement every other day. Folks, that's not normal. None of that's normal. It's also not normal to have 5 or 6 bowel movements a day. That's not normal. Or for your stool to be soft or really hard. Again, not normal. And so we just think and get into this pattern of thinking that is normal when it's not. Okay? So, the cranial nerve, our autonomic nervous system, or brain stem, the back part of your brain, is part of the brain that controls bodily functions automatically, like circulation, heart rate, blood pressure, and digestion. So these things are controlled automatically. And the main highway from our brain stem to the gut is called the vagus nerve. Now, not like Las Vegas, but Vegas. It's a Latin word that means the wanderer. And this nerve does wander. I'm going to show you a picture in a moment. Cranial nerve number 10 comes from the medulla oblongata, and it goes down and controls our heart rate and rhythm and blood pressure, but it also controls our gut motility. It controls blood flow to the gut. It controls stomach acid secretion, bile production from your liver, and flow from your gallbladder, pancreatic enzyme production, and your gut's immune system. The vagus nerve is extremely important and is often ignored when it comes to chronic digestive issues. I know many of you have never had your primary care doctor or even your GI doctor ever even mention this to you, all right? But here's how things work. Here's a picture of how many places this goes. The vagus nerve's in your brainstem, right above your spinal cord, the back of your head. And what makes the brainstem activated is input from the front of your brain, the upper brain, or the frontal cortex. The frontal cortex, or the upper brain, drives your brainstem, allowing us to breathe, have blood pressure, and our hearts work, and to digest food. And so this vagus nerve gets excited and gets working when the upper brain works properly. And then you have the vagus nerve working, we have proper gut motility, we have proper blood flow, we produce bile acids and stomach acids, and bile gets made and flows, and we have pancreatic enzymes. So this is really important, the neurology behind how the gut works. So, if the frontal cortex, or your upper brain, is not working like it should, what we're going to see are things like depression, anxiety, mood swings, memory loss, impulsivity, lack of focus. And when that isn't working, then the brain stem is not receiving the input from the frontal brain, upper brain. And then the vagus nerve starts to slow things down. You'll see things like sleep apnea and snoring. Also high blood pressure, high blood sugar, acid reflux, difficulty swallowing, digestive problems, and all these things that we talked about. We'll also see decreased motility of your gut, like constipation or decreased blood flow, so you don't absorb your nutrients. So then you have other problems showing up, like anemias and fatigue. With leaky gut syndrome, the gut barrier starts to break down, and then you don't have proper blood flow to the gut. So we get decreased enzymes and acids, so reflux again happens with bloating and ulcers and what we call small intestinal bacterial overgrowth, or SIBO, or bugs that start growing in your gut that don't belong in certain areas, and they don't grow in the areas that you want them to, and then you get infection and inflammation. So what causes the upper brain to slow down and decrease that vagus nerve function to the digestive tract? Underlying metabolic problems. You need to understand that the brain requires a ton of energy. Your neurons in your brain gobble up 30% of all of your energy. It demands 30% of the energy, yet it weighs only 2% of your body weight. So the word metabolism really means converting your food into energy. So food to energy, that's what metabolism means. If you're having any problem doing this, then the neurons in your brain don't get enough energy and they stop functioning. So what are we talking about here? Metabolic problems that cause brain decline, all right, and poor digestion. If you have blood sugar issues, such as blood sugar going too high, or your blood sugar going too low, or swinging back and forth. If you're on metformin, if you're on anything for diabetes, if your blood sugar is going too low, that will affect the function of the brain and decrease the vagus output to the gut. If you have an anemia, anemias mean you don't have enough red blood cells, which means you're not carrying enough oxygen and you can't convert food to energy in the brain, or into energy without oxygen. You can't convert food into energy without oxygen for the brain. So we have to check for those things. In your cells, your neurons, and all your cells have these little power generators called mitochondria. All right? And those mitochondria are where energy is made in your cells. And remember, your neurons require tons of energy. And so there are lots of things that can cause the mitochondria not to work very well. Your mitochondria need lots of B vitamins. They need to be able to convert blood sugar into energy. One of the most common genetic defects in the United States, even in the world, is a defect in a gene called the MTHFR gene. That gene, which converts our inactive B vitamins into our active B vitamins, is extremely important. When we eat B vitamins, or when we take them in a supplement, they're in an inactive state. A lot of people don't know that, and they need to get methylated in the body in order for them to work. A lot of people, like 45% of Americans, have a defect in that gene that makes this enzyme, and so they're not going to convert their B vitamins over into the active form. Now, folks, I'm one of them. I need to take specially formulated B vitamins that are already activated because my body doesn't do it. I have a defect in that. A lot of you may be taking B vitamins, and they're not really doing you any good. So we check for this defect. It's one of the things we look at. Now, oxidative stress also affects your mitochondria. It means that your mitochondria, the little engines in your cells, are producing too much exhaust fumes, okay? Just an analogy. But they're what we call free radicals, or superoxides. And so it kind of makes the mitochondria not work very well. And there can be many nutritional deficiencies that affect those mitochondria well, especially if you're not absorbing things from your gut. This will cause the mitochondria, those energy makers, not to work. Thyroid dysfunction. Your brain needs proper thyroid hormone levels and proper thyroid function. Adrenal dysfunction, and hormone imbalances. If you have a history of traumatic brain injury, then we know that you have an immune activation in your brain, and that can cause decreased output from the cortex into the brainstem and then your vagus nerve that then slows down, and then you've got digestive problems. Folks, neurologists know this. GI doctors may or may not, but they definitely don't check for it. I've already mentioned that there are multiple studies on post-concussion syndrome and what happens to the gut immediately after a concussion. Poor gut function, okay? How do you know if you have any of these metabolic problems causing brain decline? How do you know? All right, if you have this, or these things, how do you know if they're going on? Proper testing, folks. You have to get proper testing. Folks, I've yet to meet a patient whose doctor is checking for these things. Been doing this a long time. It's not happened yet. They just don't have the time. Some don't have the knowledge, but we'll get into some of this, okay? But just so you know. Now, I do have patients that they feel they've been tested extensively, and for those, one of the biggest complaints I hear is people come in and they're saying, my doctor ran all these tests, everything looks normal. I know a lot of you have been told that your tests are normal, and everything's fine. But let me tell you something. This is really important for you to understand. Lab ranges are inaccurate. All right. How they determine lab ranges on what can be normal in a lab and what your doctor goes by is they take the average low and the average high for whatever marker they're looking at of the people that have been in that lab for the last year. Folks, think about that for a second. They take the average high and low of whoever has been in that lab for the last year. What kind of people go into labs? Sick people or healthy people? It's definitely skewed towards sick people. So your doctor is really comparing you to the average sick person that's been to the lab. That's a ridiculous system. Now, we don't do that. We use functional ranges. We use ranges that healthy people fall into. So if you're here or here, your doctor is going to say, okay, and going to say you're fine. We're going to say you're not functioning right. So for example, let's use TSH as an example. Normal is between 0.3 to 5.7. This would be the average low of whomever's been in that lab, and this would be the average high whoever's been in that lab. So if your number were 4.2, what's your doctor going to say? He's going to say you're normal. Now, we know healthy people will fall between 1.8 and 3.0, so we're going to say you've got a problem if you show up at 4.2. So this is why a lot of times people will say, I don't have an anemia. I've never been told I'm anemic. Or I don't have a blood sugar problem. Or I don't have a thyroid problem. My doctor told me I don't have those issues. Well, number one, they're not running all of the tests that need to be run. And number two, they're looking at these wide ranges based on sick people. Folks, I don't want to be compared to somebody that's sick. Here's the other thing that you need to understand about our healthcare system. Our healthcare system is driven by pharmaceutical companies and insurance companies, and they will only cover certain labs. We don't have to follow that system in this office. We're going to run the labs and the tests that will lead to the cause and knowledge of your problem. And we're going to run the labs whether your insurance is going to pay for them or not. So I'm going to teach you a concept right now that will really benefit you in your life and in your quest for health. I promise you. If you want quality care for a chronic condition, you're going to have to think outside of your healthcare system that you're used to, outside of your insurance model. You're going to have to pay for some of it yourself. Folks, and really, why wouldn't you? I believe in being transparent, so this is a subject that I feel I got to cover when I go over a lecture. People come to me all the time, they say, oh my insurance won't cover this test or that test. Folks, well, your insurance company doesn't pay for your mortgage, it doesn't pay for your car payment, it doesn't pay for your trips or your cell phone. It doesn't pay for most things in your life. Yet you buy those things. Yet what's more important than your health? All I'm trying to say is if you want quality care for a chronic condition, you're going to have to think outside the traditional insurance-driven medical system. This is why we run these labs, whether insurance covers them or not. We've got to get to the bottom of the problem. Now, as I said, I am transparent on this, so at the end of this video, I'm going to cover the costs of what we do, all right? So the conclusion is you have to support your brain to heal the gut. All right, a proper functional neurological exam and brain-based therapy. With functional neurology, we're going to find out what areas of the brain are weak, and we're going to give you exercises to activate them. Proper testing to identify and address the underlying metabolic causes that cause digestive problems and the brain decline. And a lot of you know that since you've had these digestive problems, you haven't been thinking right. So you're unable to focus, maybe you're unable to remember things, and the things you used to enjoy, maybe you don't enjoy those things anymore. Maybe you're depressed, you're anxious, and you're just not interested in life. Folks, that's because your brain is declining, okay? This and this, again, very intimately connected, all right? So on to the next thing. On your exam, what we're going to see, if there's a vagus nerve problem or the brainstem, the part of the brain that controls your gut, if it's not working, we're going to have decreased bowel sounds. We'll listen to your bowel sounds with a stethoscope, and there won't be as many as there should. Or we look in your mouth, and we have you go, like the doctor used to do when you were a kid. And those palatal muscles, the upper part of your mouth, it won't raise up like it should. Or you'll see an increase, or maybe even a decrease in your gag reflex. Touch the back of your tongue. And if we get too excited, that means your vagus nerve is not healthy. If it doesn't do anything, that means the vagus nerve is not healthy. So, and you can also have difficulty swallowing if you have a vagus nerve issue. So in functional neurology, we find the weak areas of the brain and we help make them healthy. So let's discuss the other causes of digestive problems. Hypochlorhydria, which I see in probably about 75% of my patients with digestive problems. This is where the stomach is not producing enough acid, low acid. And yes, I know I said low, and we're going to talk about that. Autoimmune disease like celiac, Crohn's, ulcerative colitis, and inflammatory diet. Okay, basically the standard American diet is very inflammatory. There are hidden gut infections, dysbiosis, poor normal gut flora, medications like non-steroidal anti-inflammatory drugs like Advil and things like that will break down the gut lining, and hormone imbalances. What do all of these cause? They cause one thing. They break down the lining of the gut. That is called leaky gut syndrome or increased intestinal permeability. So when the gut becomes leaky, all right, increased intestinal permeability, as I mentioned before, it's like having holes in your screen door on a hot summer day. You start absorbing larger than normal molecules, protein molecules, and your immune system says, hey, these larger than normal molecules don't belong in your body, so we increase your immune activation. And your immune system starts to attack it with antibodies, and that can trigger an autoimmune problem. It can also cause inflammation in your body and also in the brain. So it can also cause you to start to develop sensitivities to food. In other words, you eat a food and now your immune system has made antibodies against it. So each time you eat it, those antibodies are there waiting to attack it, and it causes further breakdown of the gut lining. So we have this vicious cycle, this whole inflammatory condition. What I want you to understand is that 80% of your immune system, again, we mentioned this before, is in your gut. So when you activate the immune system in the gut, it's going to affect the whole body and your brain. It's going to cause joint pain and heart disease. Folks, heart disease is not a cholesterol problem. Cholesterol will never, ever, ever clog your arteries unless your arteries are also inflamed. Brain fog, skin problems. Oh my. I can't tell you how many people come to see me with eczema, psoriasis, skin issues, acne, you name it, and the problem is in their gut because they're activating their immune system. When you activate one area of your immune system, like in the gut, you're going to activate other areas of your immune system because there's crosstalk between different parts of your immune system. It's like when you find something out, you hear about a bit of news, you better believe that you're going to tell your spouse or your cousin or your best friend. They're going to find it out too. So, because your immune system, it's all connected. So in your lungs with constant coughing or having to clear your throat, getting sputum out, or sinus draining and all that's a sign of chronic immune activation. And most of the time it is due to problems in your gut with leaky gut syndrome. Now it's time to talk about this hypochlorhydria. With hypochlorhydria, you need to understand that, and I'm not going to get into this too much, but your stomach should be very, very acidic. It is the only area of your body that should be acidic. And the reason why, because we all eat germs, there's germs in our food, and so the acids in our stomach are there to kill them. Proteins are also very hard to digest, so the acids help break down proteins. And this is the third reason, it's very important. When the food leaves your stomach to go into your small intestine, that's where the food gets absorbed. There's very little absorption that occurs in your stomach. 90% occurs in your small intestine. When the food leaves your stomach, it has to be a little acidic, or very acidic actually. If it's not acidic right when it leaves, it's not going to trigger the release of bile. So the gallbladder becomes an issue, and you're not going to release digestive enzymes from the pancreas. The pancreas also releases sodium bicarbonate to neutralize the acidic food so that it's not acidic going through the rest of your digestive tract. So the bottom line is when the food leaving the stomach is not acidic, you're not going to digest. And the food will end up becoming too acidic through the rest of the way through your intestines, causing things like colitis, polyps, diverticulitis, and it's going to kill all your normal gut bacteria and cause all kinds of problems. So I'm going to ask you a question. If you do not have enough acid in your stomach, do you think your food is going to sit there longer or shorter than normal? If you answered longer, you'd be right, because there's not enough acid to break it down. So if your food sits in the stomach longer than normal, how are you going to feel? Folks, you're going to feel bloated. You're going to have indigestion, you're going to have extra burping, you're going to have belching. All right, does that make sense? Second question, if your food is sitting in your stomach longer than normal because of low stomach acid or the pH isn't right, what are your chances of the acid you do have getting pushed up to your esophagus where it doesn't belong? Are they greater or less? If you answer greater, you'd be correct. If you have low acids in your stomach, the chances of the acids getting pushed up into your esophagus increase. Now you understand more about acid reflux than most doctors. Acid reflux is you have too much acid up here because you have too little acid down here. The food stays there too long and it gets pushed up, So then the medical solution is to give you things to lower your acid, like proton pump inhibitors, like omeprazole or Nexium or Prilosec, or you're eating Tums all the time. Now, that'll give you relief, but what's the cost? It's preventing you from digesting and absorbing food. This is why you see commercials for Nexium and Prilosec that say, don't take this product longer than 14 days every 3 months. You're not going to be absorbing your nutrients, and you can develop osteoporosis and all kinds of nutritional deficiencies on these medications. Yet I see people all the time that are on these medications for years, and they come in and they're fatigued and they're tired and they have all kinds of issues and joint pain and fibromyalgia because they're not absorbing their nutrients. If you have low stomach acid, your food's going to sit there too long, and then the acid that is in the stomach doesn't get emptied, and it can cause ulcerations and things like that. And there's more to this that we can't talk about, or we'll be here for a couple hours. So I do hope you can understand that. Hypochlorhydria is the #1 cause of acid reflux and esophageal problems. It leads to infections because you don't have the acids to kill the critters that we eat. It leads to bloating, belching, abdominal pain, intestinal ulcers and intestinal bleeding, gallstones, pancreatitis, small intestinal bacterial overgrowth, colitis, systemic acidosis. You're not going to be able to absorb your magnesium and calcium, so your body becomes too acidic. And then you're going to be leaching calcium and magnesium out of your bone to alkalize your body. That leads to osteoporosis, poor absorption and nutritional deficiencies and fatigue. Folks, this is not the way you want to live, okay? What causes hypochlorhydria and low stomach acid? Well, the nerve that controls that is the vagus nerve. And we talked about that. Low thyroid function. Your thyroid function has a lot to do with producing acid in your stomach. Low zinc, a condition called pyroluria. A genetic condition, this is a genetic condition where you're basically peeing out all your zinc. Hate to be gross. And you lose B6 and essential fatty acids. You can have H. pylori infections. And these are common bacterial infections which lower your acids. You can have autoimmune conditions like pernicious anemia. You can have food sensitivities. Proton pump inhibitors will decrease your ability to produce acid in your stomach. How do you know if you have any of these things? Folks, you've got to test. And this is what is happening. This is why you're still suffering. You've got to do the right test. #2, okay, autoimmune diseases and digestive problems. Autoimmune means your immune system is attacking your own tissues. It shouldn't be doing that. It should be able to recognize your body from what's not your body. The 3 main ones, autoimmune conditions, are celiac, Crohn's disease, and ulcerative colitis. These are collectively known as inflammatory bowel disease. Now, there's a vast difference between the medical management and functional medicine management of autoimmune diseases. The medical approach is to suppress your whole immune system by putting you on things like Humira, Enbrel, or corticosteroids to shut down your immune system. Plus, they're extremely expensive medications. Let me tell you, that is not really a good big picture plan because you need your immune system. With functional medicine, we're going to remove the main triggers to the autoimmunity, and there are a lot of them. There are food sensitivities, blood sugar issues, infections, and all kinds of things that we can identify and work at removing so you get better. We're going to balance the 2 halves of your immune system, and we're going to heal the gut with known botanicals, amino acids, minerals, etc. Now, if you have celiac disease, Crohn's, or ulcerative colitis, get my full-length video on autoimmune disease. I can't get into that too much on this video, but this video explains how we manage to support people with autoimmune conditions. All right. #3, an inflammatory diet. Now, we talked about food sensitivities. You have these, and the food you're eating and your body reacts to it, you're going to get chronically inflamed. Let me tell you, most of the symptoms of food sensitivities are outside of the gut. Okay, they're not gut issues. Sometimes they're neurological. They're things like vertigo, depression, anxiety, mood swings, all kinds of things neurologically, memory loss, brain fog. So if you say, oh, I don't feel anything on my gut, a lot of things can be like skin issues that can show up. But a lot of them are not in the gut. So we do specific testing to see what foods your body reacts to. Lectins, they're foods. plant seeds and things that we eat, and they all have their own immune system, and they make certain antibodies. If you eat them, it can be bad for your immune system. Certain foods have very intricate immune systems, and they make a lot of these antibodies, and they call what we call lectins. So, for example, the nightshade plant group, tomatoes, potatoes, peppers, and eggplant, they all have lots of lectin in them. And a lot of times this can cause inflammation in your gut. There are certain foods called FODMAPs that are different sugars that some people have a hard time breaking down, alcohol sugars. And so we need to check for that too. Kind of a theme here. How do you know if you have any of these things? Proper testing, folks. You got to do the proper testing. Hidden gut infections like H. pylori, parasitic infections, yeast, fungal, candida infections, and viral infections. Most of my patients, I want to say almost all of them with digestive problems, they have gut infections that are never really checked for. Or they're using a lab that maybe the doctor did check some things, but they're using a lab that they don't have good controls, so they don't know if it's really accurate or not. The causes of gut infections. Well, if you don't have enough acid in your stomach, and we all eat bugs that are dumped into our gut, and the acids aren't there to kill them, you're going to have issues. Food sensitivities. When your immune system is too busy fighting foods, it's not able to fight off infections. Inflammatory foods like alcohol. Antibiotics is a big one. If you're taking antibiotics for whatever reason, that's going to kill the good flora, which is part of your immune system. And your ability to fight off infection is decreased. All right? Not having balanced gut flora, dysbiosis. A high refined carbohydrate diet, eating a lot of sweets and sugars. Yeast love that stuff. You're never going to get rid of a yeast infection if you have that kind of diet. So proper testing is crucial here. There is a lot of testing out there that doctors do in their offices that frankly is just garbage. They're what we call false negatives or false positives, where in other words you have an infection but the test comes back negative, and it's falsely negative. You can also have those, like I said, false positives. You must fix the underlying causes and kill the offenders. It's absolutely crucial. If you have gut infections and you don't get rid of them, then it isn't going to happen. Now, we're going to use some very well-known botanicals, and they're all in a few pills. We'll have you take these separately and mix them together, or formulate a batch just for you, or a capsule. Things like aloe leaves, Spanish moss, marshmallow extract, gamma arsenal, the slippery elm bark, German chamomile, wormwood extract, olive leaf extract, garlic extract, berberine, yerba, oregano extract. All of these are known to kill bacterias, viral, yeast, and parasitic infections in the gut. Folks, I'm telling you, I've been doing this a long time. This stuff works. It works better than antibiotics most of the time. Antiparasitics or even antifungal medications without side effects. We'll also use probiotics, things that help destroy pathogen and help you heal the gut. Okay, get rid of those pathogens, those germs that shouldn't be there. Saccharomyces boulardii is a good one. Lactobacillus and bifidobacter, they're the main ones. But on your stool test that we run on you, we're able to identify exactly what probiotic you need. Folks, just don't be running out willy-nilly and buying probiotics. You could be taking the wrong one. If you have an overgrowth of lactobacillus and you're taking lactobacillus, then you're going to get worse. So we need to test. It's like the cold carpenter's rule, right? Remember that rule? Measure twice, cut once. You got to make sure you're being accurate. In our office, we use a 6 to 8 week gut detoxification and dietary nutraceutical program called RepairVite and ClearVite, which we explain very clearly to all of our patients and have our certified health coach go over with you. Number 5, dysbiosis or small intestinal bacterial overgrowth. This means that there's too much bacteria in one area of the small intestines and not enough in the large intestines. And that can cause a lot of problems. This is considered by most to actually be an infection. You can have too much of something good, then it becomes not so good. The causes of this are low stomach acids, that hypochlorhydria. If you're on antibiotics, if you're taking antacids all the time, like Nexine or Prilosec, which knock down your stomach acids, then that will cause this to happen. High sugar and alcohol. Food sensitivities, those FODMAP foods will all cause this condition. It's very, very, very common. Okay, the symptoms of dysbiosis or small intestinal bacterial overgrowth are gas, bloating, diarrhea, sometimes constipation, abdominal pain and cramping. This is the person who's afraid to go out because they don't know if all of a sudden something's going to happen. And then you have to pull over or find a restroom. I mean, I see this stuff a lot, and this is the stuff, it's so easy to diagnose and clear up. Even autoimmune diseases, okay, can show up here. So proper testing is crucial. We'll do a stool test. Sometimes we can do a breath test. We do an organic acid test to identify the underlying causes. Then we'll put you on the Repair Bite and Clear Bite program, the detox program, with specific supplements based on what we see on your labs. Okay? You've got to understand that antibiotics kill everything. It's like friendly fire in a war. They're just throwing bombs on everything, and everybody's getting destroyed. That is what antibiotics do. And by the way, folks, antibiotics means against bacteria, against a life. If you have a middle ear infection or your child has a middle ear infection, 99% of the time, it's viral. They shouldn't even be taking an antibiotic. And that's a whole other topic regarding kids. But when they take it, they're knocking out all their good bacteria in their gut, which you need. Proton pump inhibitors will lower acids and cause hypochlorhydria. And now you lose your ability to kill things, digest, a whole slew of problems we already talked about. Antacids, they lower your acids. Non-steroidal anti-inflammatory drugs like ibuprofen and aspirin and naproxen, they destroy your gut lining. So many people have guts that are so bad because they're constantly taking things like Advil and over-the-counter medications that they think are harmless, but they are really not. All right. Hormone imbalances, all right, and your digestive gut health. High cortisol. Cortisol is a stress hormone from your adrenal glands that sit on top of your kidneys. When it's elevated, if you're under a lot of stress, and when I say stress, we always think of emotional stress, but I'm talking about even physical or chemical stress. Let me tell you, having an anemia, not getting enough oxygen to your body, is so much more stressful on your body than even going through a divorce. Having a gut infection is so much more stressful on your body than suffering a death of a loved one. So I'm telling you that there are a lot of physical and chemical things that you don't know are stressing your body that we're going to be able to identify and remove. But what I want you to understand is that when your cortisol is high, it's going to break down your gut lining. High cortisol is really the arch enemy to your thyroid function. Okay, so if high cortisol, your thyroid's not going to work. High cortisol decreases thyroid function and causes low thyroid function, and that leads to poor digestive function. For women, a lot of women don't have proper progesterone and estrogen balance. Mostly they don't have enough progesterone to balance out the estrogens. That will cause destruction of the gut and lead to estrogen dominance. By the way, estrogen is one of the hormones that is really, really hard to get rid of in the body. What happens is it goes into your liver and it gets conjugated, and then it goes into your gut, into your stool. And if you're constipated, then it gets deconjugated and reabsorbed back into your system. So if you're constipated, ladies, I'm telling you, the chances of you being estrogen dominant are really increased. And most of these cancers, like breast cancer and ovarian cancer, are estrogen-fed tumors. All right? Testosterone and estrogen ratio are really crucial in men. Okay? So here's a recap. Right here, the cause of digestive function is multifactorial. There's more than one thing, or even more than two things. There are many, many things that are going to be going on. Now, this is the exciting part of what we do. We're going to act like detectives, and we're going to sleuth things out here. We figure out what is going on through the proper testing, and that is the way we can be very laser precise on what your particular problem is, or what other problems are, and we go about addressing them as naturally as possible. All of the causes have got to be identified. If you miss one or two, then that's not going to do it. We hear all the time, oh, I went off gluten, and it didn't really help me. I started taking a probiotic, and that didn't help me. Folks, that's like a shot in the dark. It may be one of the pieces of the puzzle. But if you have these problems because you have multiple things going on, we've got to identify all of them. You need to remember also that poor brain function leads to poor gut function. And then poor gut function is going to lead to poor brain function. They're intimately connected, and the highway between those two, again, is that vagus nerve from your brainstem. So just this component being left out is oftentimes the difference between success and failure. Underlying metabolic problems can and will lead to brain decline and digestive problems and trauma to the brain too. These must be addressed properly through functional medicine and functional neurology. All of the following causes must be identified: hypochlorhydria, autoimmune diseases, inflammation, food sensitivities, infections, those FODMAP foods, poor mitochondrial function, dysbiosis, medications, and hormone imbalances.
Hi, Older Me back again. Now, what's next? Please understand this. Knowing something and not doing anything about it is just like not knowing it. You need to take action. My team cannot help you unless you call us and make an appointment, okay? So we schedule you for 2 visits, and here's what we do on your first 2 visits. When you call and schedule an appointment, tell them that you saw this video in its entirety. We will not see anybody until they've watched this video or have seen us give a class on this information, because we don't have time to explain all this in our office. We're very busy, and someone cannot just come in and say, hey, I understand your office manages these type of problems. That won't work. They got to know what we do. We don't have the time to explain all this data one-on-one. That's why I make these videos. We're going to have you bring in any recent labs, okay? Bring in any recent labs. You don't have to run all over town getting them, but if they're easily accessible, bring them in. They can be helpful. When you call the office to make an appointment, they're going to mail or email you some very important paperwork for you to fill out prior to your first appointment. Fill it out before your first appointment. And at your first visit, we want you to bring your spouse or significant other. We need them to understand what is going on. You got to understand, if you're watching this alone without your spouse or significant other, this is affecting them. And you need to realize that they need to see that there are options out there for you. So on visit number 2, so this is visit number 1, this is visit number 2, we're going to let you know if we can accept your case. Now, what do I mean by that? Some people come to us and they're like, I don't want to make any lifestyle changes. I'm not going to make any changes. Just fix me. Well, I want you to know that's okay, but don't come see us if you have that attitude, all right? You'll waste your time and your money and our time, all right? And you have to have an attitude like, you know what, I'm sick and tired of being sick and tired, and I want answers, and I'm not getting any answers, and what you say makes sense. So if this doesn't make sense, if what we've gone over doesn't make sense to you, that is totally fine. But respectfully, we're likely not the right place for you. Honestly, this has to make sense to you. Otherwise, it's not going to be worth it. So on visit number 2, we're going to go over any and all further testing you'll need to do. So we're going to review everything that we found in visit number 1, go over further testing that will need to be done. We talked about all the testing that someone might need. We're going to review what we think you're going to need. And we're going to overview your treatment plan. Most of our metabolic patients are managed in our office for 6 to 12 months. Usually after that time period, you don't need us anymore. We'll have it figured out and we'll teach you. This is a teaching program. When you come see us, you're going to be taught. We're going to identify the underlying causes, and we're going to teach you how to manage that for the rest of your life. There's an old saying, you can give a person a fish and feed him for a day, or you can teach him how to fish and he'll feed himself for a lifetime. Nothing pleases our team more than to run into a patient we haven't seen for years out and about, and we hug and kiss and cry or whatever, we high five, and they tell us how good they're doing, how good they feel, how their life is better, or better yet, their kids tell us mommy or daddy is better. That makes everything that we do worthwhile. The stuff that we do is not easy. It's taken our team thousands of hours of postgraduate studies and hours in independent study to learn all of this. And this is the benefit you're getting when you come to see an office like ours. We're going to overview your treatment plan. All right. How often do you need to see us? It varies. If you have musculoskeletal problems, we might need to see you more frequently. But typically, for metabolic problems, a patient is going to come in to see us about twice a month. On the second visit, we're going to overview any financial obligations that you have. What is it going to cost you? And I'm going to give you a rough figure in a few minutes of that. On that visit, we want you to bring your spouse and significant other as well. Why do we want them on the second visit? Because we're going to go over what's wrong or what we found. We're going to go over what it's going to take to get you better and what it's going to cost. We like to be transparent, and you should come in already having a pretty good idea what it's going to cost, which I'll go over here shortly. So to recap, what you need for your first appointment. You need your paperwork filled out completely. Bring it in filled out. If you come in and we've reserved an hour for you and you don't have the paperwork filled out, we may not have time to see you. We have a busy practice and we do everything we can to run on time. And you filling out the paperwork on our couch will eat into that time. You'll be happier if you use your couch at home to fill it out ahead of time. Again, on that first visit, we want you to bring your spouse or significant other and have them there. If your spouse is involved in any way, shape, or form in your health and your decisions, then we want him or her to be at this appointment with you. It just works that much better. All right? So here's the offer that I'm going to make to you. We only accept 10 new metabolic patients per month. That's all, 10 per month. We don't just jam up the schedule, leaving the provider team no time to see you and help you. That's no good. So we keep our patient load limited so we can give the best care possible. Right? The cost of these two visits that I just went over, these two here, the cost of those two visits is $550. If you make an appointment after watching this video, then that $550 is reduced to $170. And that does include the first visit's lab work, okay? So here are our rules. There's just some rules we have. We want to be very clear. You've got to be willing to make some serious life changes. Something's got to change. If you keep doing the same thing over and over and over, but expect different results, you're going to go insane, all right? And I know that's been happening to some of you. You just don't know what to do. That's what people hire us for. So when you do what we recommend, it'll work because it's not guesswork. It's going to be based on what we see in the lab work. So you've got to be willing to change some things in your life, folks. That's just the way it is. Please don't shoot the messenger. It's just a fact. You have to take accountability for your health. Can't blame your parents. You can't blame your spouse, your kids, the president. It's you. And once we teach you, then it is up to you. Now, we do accept insurance in our office, but please understand this. Please understand this very clearly. Insurance does not cover all of this. It actually doesn't cover much of it all, if anything. And I mentioned why earlier in this video, if you recall, so I'm going to give you a rough guideline. If it's not worth $300 to $500 per month for 18 months, we can do an 18-month payment plan. If it's not worth $300 to $500 per month for 18 months, now you're not under care for 18 months. I mentioned that. We usually see patients for 6 to 12 months, but we can stretch out the payment plan. If it's not worth $300 to $500 per month to you, potentially interest-free for 18 months, then we might not be the place for you. I'm giving you a rough idea of what it costs. Now, some patients will pay it all up front and they get a discount. We'll go over exactly what your care is going to cost on your second visit. And just so you know, you're under no obligation. You could do whatever makes sense for you, but it does have to make sense for you, okay? Now, you should ask yourself, all right, on a scale of 1 to 10, how serious is your illness? What you have is a chronic illness. They don't get better on their own. They only get worse. Nobody has a magic wand here, okay? They're gonna change. It's gonna get worse over time. So where do you see yourself in 1 to 3 years from now? You should look at that. Where do you see yourself from 1 to 3 years if nothing changes? Due to time constraints, we can only accept those that are truly committed. You'll be amazed at how healthy you can get once you go to someone who truly understands the underlying causes and addresses those causes. So I hope this makes sense. If you're watching this and you're ready to really make a change in your life, please call our office, make an appointment. Let's get started. We hope to see you soon.
Hi, my name is Mary. I came to Magnolia Medical Center because I was having a lot of stomach problems and conventional medicine failed me miserably. Pushing a lot of medications at me and not showing me what I needed to eat to heal myself. Dr. Hillary, she was wonderful. She was patient with me and she explored every avenue as far as getting me healthy. The testing they do here is just, it's wonderful. You don't get the testing with conventional medicine as far as your gut bacterias and, you know, what good bacteria you have and what bad bacteria they need to kill off. I was here for about a year, and I was a tough case. It just took me a long while to heal up, but Hillary finally figured it out, and I'm thankful. She never gave up on me. It was phenomenal, and I would tell anybody to come here. Pushing pills at people is just not the answer. People need to learn how to eat correctly, and that's all there is. That's the only way you can heal, is if you learn how to feed your body and heal your body through food. So my life is so much better now. I couldn't imagine having not come here. I gained 10 pounds. I had initially lost 40 pounds when I was sick over a year ago, and I've gained 10 pounds back, and my cholesterol has dropped, and things are just good. And my life has changed forever. I will always know how to feed my body and always take care of myself. That's just my number one rule, so I don't get sick again. Anyway, I want to thank everybody here. Everybody did a fantastic job in helping me. They care. They absolutely care about people. And you come in and you spend 40 minutes talking, and they just go above and beyond to help people. And I owe them everything.